Thank you so much, Mr. Chairman, and thank you for doing this important hearing. I always said healthcare is, I pick my hills to die on, but healthcare is the hills that we should take if we want to save this country from complete bankruptcy and save American people from complete bankruptcy. It's becoming the biggest debt driver for American families, for state budget, for federal budget. And if you think about it, our pre-COVID total budget was $4.5 trillion total spending. Now it's $7 trillion. Per year, and we run huge shortfalls, and it's all mainly attributable to increases in healthcare spending, and our roughly double our debt, and mainly attributable to healthcare, and we're not getting healthier. And from developed nations, we have some of the worst outcomes is how much money we're spending. So I kind of say this became like a weapon of mass destruction, but it is. So my questions for you, I know that you're very, very smart people, but and maybe I'll start with Dr. Blase. Do you think the problem we also have, since majority of this healthcare spending sits in mandatory automatic spending, so Congress really never has to look at take a vote. So we look at the spend, and I'm like, wow, we're spending a lot. It seems like per person spending is really increasing, but Congress really never have to look and vote at it because it's like on steroids, and that is actually creates enormous opportunity of fraud because, it's a kind of like almost a money laundering operation from anyone who can't get now in that business, from cartels, from equity, from healthcare cartels, from everyone now is in that business. And, so Dr. Blase, what do you think? You brought up a few issues where it's happening, but what do you think? Is there something maybe we should start looking at the spending and start voting instead put it in the automatic spending? I wanted to get your thoughts.
Yeah, thank you, Congresswoman, and I appreciate your dedication to the importance of this issue and getting government healthcare programs back on sustainable trajectory. You are going to have a moment when the Part A trust fund reaches expiration. That will cause Congress to act. The Part A trust fund is, it's a hospital part of Obamacare or of Medicare. It is funded with a payroll tax. It is running on past surpluses. That's going to reach insolvency within probably the next 5 years and would require an across-the-board 10 to 15% cut in payments. Congress is going to have to address Medicare insolvency and the challenges with Medicare at that time. There are just enormous challenges with Medicaid and the Affordable Care Act as well. Those programs have increased astronomically over the past 5 years, and in order to get the fiscal house in order, Congress needs to look at federal health programs. It is the one area of the federal budget that is growing most rapidly, save interest payments on the debt.
Thank you so much. And we talk about funding, Government Accountability Office. They give us reports, but we do nothing about that. So giving them more funding is not going to do anything unless Congress will start acting on their findings. So, that is kind of almost hypocritical for us even to blame someone as more funding if we do nothing about it. They have enormous amount of proper payments. We don't even do the hearings that we used to do and actually looking at the areas of risks and focus that they brought up to us. We do nothing. We just complain here and do hearing after hearing and blaming someone and do nothing about it. So I put all fault on Congress. Dr. Meyers, you brought up some interesting issues, and I think it's a big issue. It's a consolidation, vertical integration. It seems like we have this big oligopoly problem, and we keep subsidizing more and more, to the larger, and then everyone will be too large to fail, and then we subsidize more and give more perverse incentive to consolidate. And if you have few oligopolies, a kind of like oligarchy we're creating, they can dictate any price they want. I mean, this is just a reality. We have no competition. I want you to elaborate a little bit more. You mentioned that, and what do you think the solutions would be?
Yes, thank you so much for that question. It's a really important issue of sort of consolidation, both horizontally and vertically in the healthcare market. The Medicare Advantage program is now largely run by 3 or 4 major health insurance companies that are dominating the entire program. And so there's been a lot of this horizontal consolidation, but a bigger challenge has been this vertical consolidation. United Healthcare is the #1 employer of physicians in the country. And while this maybe could lead to some efficiencies, if it does lead to better coordination of care, the major concern is that that can be used to maximize payments and play around in the rules of the program in different ways. In work that my colleagues and I have done, we've found that as soon as a physician starts working for a vertically integrated practice, so they start working for a plan owned by a health plan, we see their risk scores go up 50%, even though they're treating the exact same patients and the actual health status doesn't change. These vertical integrations also lead to this potential to get around these MLR requirements, that plans need to spend a certain amount of payment on sort of care and then a certain amount in overhead. And we're seeing in these vertical arrangements, you can charge yourself more money on the provider side of business in order to shift those profits from the plan side to the provider side to get around other rules that Congress has put into place. And so this is a major issue. There are different ways that this can be addressed, either directly through tackling the issues around risk adjustment and issues around the MLR to get better quality reporting there, to get better reporting of the situation in general. When we try to look at this, we need to find these health systems by hand and put them together. There's no transparency of what these ownership arrangements look like, so we can start there. And once we know sort of who owns who, we can then figure out how to follow where the money's flowing from and try and make a difference about it.
Thank you. I yield back.